Welcome to another video with TrialJoin. In today's video, we're going to go over negotiating clinical trial research budgets and reimbursements for audit fees. Let's start off with a little bit of an introduction of negotiation. One of the first and most important steps before beginning a clinical trial is the negotiation process between you and the sponsor or the CRO. Negotiation is an art which can be learned and put into practice fairly easily, so if you don't know it already, don't fret. There will be a few tips I will give throughout this video. Being a successful negotiator means that you know how to talk and how to convince others in the party to give you what you need, and while at the same time giving them a sense that they're also getting a lot for their work. When it comes to negotiating a clinical trial budget, there are many things that you should keep in mind. Procedures, the complexity of the protocol, advertising budgets, enrollment and randomization, budget, PI and staff experience, past site experience, and because of the large number of details in negotiating an agreement, it often happens that a site will forget to include important points for reimbursement. One of the biggest examples is an audit fee. So one question you got to ask yourself is, have you agreed to be reimbursed for audit fees? Did you decide in which way you'll do this? If not, then continue reading below and we'll give you some ideas of how to achieve this. So one thing to think about, should I put this audit fee item in the budget or in the contract? Well, frankly, it doesn't matter. In reality, it doesn't matter whether you put the audit fee reimbursement item in the initial budget agreement or in the contract. The important thing is that it's written down somewhere. When negotiating the initial budget, make sure to also mention the audit fee reimbursement. Once the sponsor agrees to this, then they can decide whether to place this item in the contract or the budget itself. Justifying your audit fee is crucial in order to get the sponsor to agree. So what types of audits can you expect? There's the FDA's audits, there's a sponsor audit, IRB audit, or a CRO audit. An audit is an official inspection of the site's organization's accounts, usually regarding finances, legal, or other documents. So a clinical research site can expect to be audited by many of these organizations. So how can you charge for an audit fee? Well, there's two main ways that you can charge for an audit fee. Hourly, by the amount of audit hours you spend, or daily by the amount of days that you spend. Charging daily is usually the simplest way to charge and get reimbursed for an audit. This is because it simply means that even if the audit doesn't last a whole day, you'll still charge for a full day. For many audits, such as the FDA audits, you'll need time for preparation, so this is also something they should charge for as well, the preparation time. Charging hourly is another way to get around to it. You can charge somewhere between $100 to $300 an hour. So that means if an audit lasts for 6 hours, you could potentially make anywhere between $600 to $1,800 for that day. Of course, you want to charge hourly based on the staff that's required to prepare the documents and go through the audit requirements. Here are a few considerations when calculating an audit fee. Even though the above two scenarios might seem like a lot to ask, in reality this is perfectly normal and sponsors are expecting this already. Many sites are already asking it, so don't feel ashamed to ask it or even shy. When we're talking about audit fees, we cannot think of only the audit fee itself, but other things such as preparation time that your staff has to spend or you have to spend, your coordinator's time, other staff's involvement, and missing patient visits that you could potentially be getting reimbursed for. There's some things that you can leverage for negotiations of clinical trial agreements. So now that we've explained how to calculate an audit fee in order to get reimbursed, I want to focus on teaching you how to have more leverage and gain more from your negotiations. When preparing your offer, you should consider increasing your leverage as much as possible and show the site's best attributes and qualities, and always put your best foot forward. So you need to show them the upside of choosing you instead of your competition. However, for this to work, you need to back it up with proper documentation and proof. The best way to increase your leverage is to think of what a sponsor will need from your site and try to give them that. Here are a few things that you can leverage. Number one is having a great patient recruitment strategy that you've used in the past and you want to replicate. Having high success rates in previous similar studies. Another one is being able to perform more complex and advanced procedures. Next thing is showing actual numbers as proof of your past success, for example, by using metrics on your site. Another thing is by using an EDC system on your site. And then having an ideal geographical location that fits the sponsor's study requirements. Another thing is presenting the proof of your staff and PI's experience, their CVs. Another thing is having a good presentation with actual facts and justifications when you do any initial communication to gain the study for your site. And having a good attention to details, because that does go a long way. And remember, every time you bid for a study, just make it a repository where you improve on and take notes of how you could improve on your previous bids and your negotiations, and always keep notes. So this way you can make sure you're not forgetting any budget items. You can obviously calculate the budget with a CTMS, and there's many systems out there that we can recommend. We've recommended in previous videos, so definitely check those out to get some of our recommendations. With a CTMS, it's really easy to calculate a budget based on your historical data and seeing how much you've charged in the past. So this way you can give them an actual budget number and know what your margins are, and that gives you a great point to negotiate with the sponsor, so that way you can give and take on certain points to, because it's going to be a sum of all your micro battles in essence to get the whole contract done. So one procedure might cost a little bit more, another one might cost less. So if you know your margins, you know which ones you can budge on and which ones you can't. At the end of the day, being properly reimbursed for all costs and fees that arise throughout the duration of a study is extremely important, especially if you wish to work with a profit. However, many sites tend to forget and neglect some of the important budget items, and one of them is the audit fee. This is commonly forgotten, and we cannot stress how much it is important to have that. While it might not happen that often, it does happen. There might be numerous audits during a study, and you may want to get reimbursed for them. And when I say numerous audits, they're usually going to come from the sponsors and CRO levels, not the FDA. So FDA audits only happen occasionally and very rarely, to be honest. And so make sure you're getting reimbursed for all the audit fees at the end, and that's the biggest point we want to make with this video. Thank you for listening, and thank you for watching.